I'm Dr. Sharath, Chief Consultant Plastic Surgeon at Arete Hospitals. Today I wish to speak to you about abdominoplasty. Abdominoplasty is by the name itself, it means that correction or strengthening of the abdominal wall, and usually undertaken in people who have lax abdominal walls with or without associated hernia. If somebody feels that they have a lax abdomen and a heavy abdomen that needs to be corrected, they need to have a plastic surgical consultation. Usually it is seen in women who have multiple pregnancies, prolonged labor, large baby, and weakness of the tummy wall may be associated with a hernia. Hernia is again contents of the tummy protruding through the muscle wall to below the skin. It can be of varying degrees depending on the duration of the hernia and increase in intra-abdominal pressure due to various conditions like constipation, coughing, chronic cough, or straining basically. So, if somebody feels that they have the above mentioned issues or the abdominal wall complaints, or aesthetically also they want a correction with age, looseness of the tummy wall and slackness of the abdominal wall needs to be corrected, they need to consult a plastic surgeon. The plastic surgeon does a clinical examination, looks at reasons for asking for the abdominoplasty, and then might ask you for an ultrasound of the abdomen to look for any hernia and extent of hernia. A planned surgery involves usually general anesthesia, wherein a pre-surgical evaluation by means of blood test is done. It takes about 3 to 4 hours or longer depending on the abdominal wall correction and the associated hernia or not. Usually patients are advised about the surgery duration, stay, which could be 3 to 4 days in the hospital, and post-operative recovery period, which is about 2 weeks for the wound to heal reasonably, and compression garment to be worn for 6 weeks. Sometimes some prefer 8 weeks for the abdominal wall edema to reduce and healing process to be complete. Scar management techniques are taught to them about scar massages and other interventions which are required. Some people develop hypertrophic scars or keloidal scars, but the clinician does an evaluation to see if they are at risk and then advises appropriately and manages them if there is a risk of such in future. Post-surgery, in the initial phase, after the surgery, when you come back to your post-operative recovery area and then you're up and awake, they shift you to the room. You might end up with drains, which are tubes between the skin and the abdominal wall, which drain out fluid, and the surgeon might leave them for a couple of days till he's sure that it won't drain in a heavy manner, and sometimes if it is less than 50 ml per day, the drains are removed. And some surgeons may prefer that the patients go home with the drains. Very few sometimes don't put a drain, and even those are managed with compression garments. Mobility, when you are discharged, you are made to walk and made sure that you go home able to be functional at home. Some go for an early bath about 4 to 5 days later, when certain types of dressings, which are waterproof dressings, are put, and some prefer taking a bath after a week by taking off the compression garment and putting it back. The drains are removed, as I mentioned, sometimes late by surgeons, and they might call you back to the clinic to remove the drains. The scar management techniques which are taught are scar massages with creams, silicone gel sheets sometimes, and the compression garments help in minimizing the edema and making the patient feel confident and comfortable in the initial post-operative period. Good pain relief is given post-surgically, and when you are discharged, you are given tablets to carry on for a few weeks so that you are mobile, quite active, and able to carry out your day-to-day activities without being inhibited. And once you are comfortable, you are taken off those medication. You can expect a reasonable result from abdominoplasty, and the surgeon would be the best person to explain to you what to expect and what sort of activities you can take, you can undertake after the surgery. About 3 months you are advised not to lift weights, and initial 1 week later walking is a general activity. 2 to 3 weeks the activities can be more strenuous and depending on your comfort range. Driving a vehicle as and when you can put an emergency brake is how practical the advice. I think we would normally cover in a consultation about general questions about diet, exercise, return to general activities, and prepare you if you are a person who is correct or suitable to have this procedure called abdominoplasty.